HIV, don't be too sad because it's not life-threatening again, and there's help because Ghana faces a rising HIV epidemic with lots of people affected in 2024, around 68% or so are women. And then we have over 15,290 new infections. So this has become an epidemic, and there's somebody who's going to be telling us about it, draw our attention back to HIV, why we need to get tested, treated, and then how to live with it. And she's in the person of Dr. Vanessa. Greetings, how are you? Happy New Year.
Happy New Year to you. Thank you for having me.
All right. Greetings from the center. How's the center doing? The first 6 months of its existence. How's it doing?
It's been great. You know, I love seeing patients.
Okay,
I love
great.
creating great care. We've got a great team. So no, it's really going well. And we're just doing more activity to just raise awareness.
Okay.
Yes.
So for the people who are meeting you for the first time, what sort of doctor are you? We are curious.
Yes.
Are you a doctor who just treats HIV patients? So
No.
Okay, yeah. Who
But
are you?
it's a part of my work. So I'm a consultant, physician, but I specialize in genitourinary medicine. So that essentially means...
Okay, say that again.
Exactly.
Say that again.
Genitourinary medicine.
You heard that.
And then, so essentially that entails of sexual and reproductive health and HIV. So I look after women across their life course from adolescence to menopause and beyond. I manage men as well. I do sexual wellness and we also do HIV as well.
Okay. You work with women right from adolescent up until menopause or whatever.
Yeah.
Can you tell me why our gender, we're so complicated? Is it because of our reproductive system? Why do we have so many issues with ourselves?
Exactly.
Why?
I embrace that complexity as we're very, very special.
Yeah.
So all human beings are full of hormones, but particularly in women, our hormones really determine a lot of our experiences. And as we change and evolve and age, the hormone balances changes as well. And then that can create some different symptoms. But for me, it's about thriving through it all.
Okay. So why? Tell me why a lot more women are contracting HIV/AIDS.
So I think that with HIV, one of the issues is that it's a sexually transmitted infection. And when we think specifically about women, we think about the choices that people have to make or the positions that they are put in as well. So where for some women, the choice about sex and who they have sex with can be difficult, coercion as well. But also with women, you know, we are the center of communities and we are the center of relationships as well. So not all women have the autonomy and control over their rights as well.
Okay, now let's get into the conversation on HIV. First, what is HIV? And then when do we say HIV and when do we call it AIDS?
Yeah, no, that's a great question. So HIV is the virus. So it's human immunodeficiency virus.
Right.
And it's the virus that can lead to AIDS. Okay. And so AIDS is actually a syndrome. So it's acquired immunodeficiency syndrome. So HIV, what it does, the virus, it affects our bodies and it affects our immune system. And it puts us at risk of everyday infections and rare infections as well. And as you are living with HIV more advanced and it's not treated, then it can progress to AIDS.
Okay. But
the beautiful thing is, you need to move into the acquiring AIDS.
Okay. Somebody who has contracted HIV, what does it look like?
Yeah, so we've got certain cells in our body which are called CD4 cells, which are really important in our immune response. And what the virus does is that it attacks those cells. So the CD4 cells go down and then the viral load, the level of virus goes up. And as the CD4 count in your immune system goes down, that's when it can put you at risk of infections as well and the other complications.
Okay.
Yeah.
Right. So let's create awareness. What are some of the persistent myths that you like to debunk or tell us if it's a fact?
So first of all, it's just that many people think that it's certain people that can get HIV and, you know, they'll look at themselves and think, no, it's not me. But what I would say is that HIV has no face. So anyone that is having sex, anyone that's having unprotected sex could be exposed to HIV and anyone can acquire HIV. And I think getting that myth out and debunking that is really important. For me, another myth about HIV is that if I had it, I would know. And again, that isn't the case.
Okay.
Because you can be living with HIV. Just because you're living with HIV and you've acquired HIV does not mean that suddenly you have all these symptoms that you're like, okay, right, I know I've got
These
it.
are the signs of
Exactly,
HIV.
exactly.
Okay, now let's talk the symptoms. Would you feel, assuming you're one of those who think that I cannot get HIV, are there certain symptoms that should let you know that, listen, you can get HIV or you have HIV?
So, as I said, many people can be going on with life and not really realizing.
Okay.
Sometimes if you, at the time of when you acquire it, sometimes you can have a really, really severe fever, feeling really, really unwell. And then that settles and then you completely forget about it.
So that's when you contract it.
Yeah, exactly,
Okay.
exactly. And then afterwards, there can be, as it progresses, there may be things like skin changes, recurrent chest infections, weight loss, change in your bowel habits. But that can be, far later as well. So it's recognizing that at any point you could be living with it and not know about it, which is why testing is so important.
Okay. So at which point would it start to show? Assuming you don't get tested and you have it.
So
at which point?
So the difficult thing for me to say is that I can't say for each person, but
Okay.
often when you are really presenting with symptoms, it could be further along. So you could have been living with it for many years, and then that's when you may present with symptoms. The other thing is that we've all got busy lives. We've talked that the majority of people living with HIV in Ghana are women.
Yes.
You can imagine you're working, running the household with kids, and then you feel tired, and you're thinking. And you dismiss it because you assume that could be just everyday life.
Yes.
So some of these things can suddenly feel, oh my gosh, I feel much better because they've been running on 40%, 60%. But our bodies compensate as well. Yeah.
Okay, now that you mentioned it, now let's talk about testing. Is it still, do people still feel stigmatized to walk into like a pharmacy and say they want to get tested, or is there?
Definitely. Okay. So I would say we have come so far in the HIV response, but stigma is the main thing that holds us back. And it's not just in Ghana, it's everywhere. But I would say that in our societies, there's so much stigma related to sex and talking about it and infections as well. And the thing is that people suddenly feel to go and ask for a test, to go and think about, what will the person think about me? All of those limit people going for testing. So that's why I think it is so important that we have to have these conversations and broaden opportunities for testing. Okay. So it's normalized.
Let's talk treatment. So what treatment options are available?
So as I said, we have come so far in the HIV response. So we haven't got a cure, but we've got highly effective treatment. For some people, the medication is 1 tablet a day. And we're actually also getting treatment that is long-acting, that is injectables, that you will only need. For you to have treatment, you have to test, know that you're living with HIV, and then be on the right treatment. But we have treatment out there. Sometimes it's 2 or 3 tablets. In some areas of the parts of the world, it can be 1 tablet a day, but it's highly effective.
Okay.
And with treatment, you can go from having a really low, what I said, CD4 count, and a really high viral load. And our aim is to bring your viral load to 0.
Okay.
So that you are undetectable. And if you are undetectable, you're untransmissible. So you can't pass the virus on sexually.
Okay, and then for that, does it mean that you have to take your medication? Is it lifelong?
Yes, so it's every day and it's lifelong.
Okay.
And I, a lot of my work is supporting people to keep on their treatment.
Do you have people relapsing, say?
Definitely, because we're all human beings. Think about hypertension. How
Yeah.
many people do we know living with high blood pressure? They're given their amlodipine, and if you speak to them every day, every week, are they taking it?
No,
not always.
no, definitely.
So it's the same for HIV. It's a chronic condition which requires daily treatment.
Okay, so if you relapse, what happens? Do the virus, do they multiply? What happens when you go back on the medication?
That's such an important question. So yes, so the virus is the medication is keeping the virus down. Okay. So as soon as we stop taking the medication, then we allow the virus to rise. And so we have some buffer, some leeway with some of the newer medications. But if you don't take your treatment, then the level of virus rises, the CD4 count goes down, And also you put yourself at risk of resistance. So when we talk about some antibiotics,
yes, that
that
when you
concept,
take it, so many times,
And so you've got, so basically some of the virus there gets cleverer and thinks, I can get past the treatment,
Yes,
and
stronger.
so we need to then revise the treatment as well. But anyone that is listening that has been off treatment, the best thing to do is to just come and be honest and come and talk.
Is treatment expensive?
So within Ghana, you can get treatment for free. So
that's great.
Exactly.
That's
So
great.
it's accessing the services, and you can get treatment. So, and that's the thing. We have free treatment, but people are still anxious and worried about coming in and who will see them. But, I say we need to support people to live their best life. Definitely.
Okay, now let's talk about support. People living with HIV. So what do you sort of condition their family members, maybe their partners? What's the 411 when it comes to support for victims and families?
Definitely. And supporting them, that if they have a partner and they have a sexual partner, about supporting them to let their partner know, so their partner can also be tested as well. And then also with children, because dependent on when they were diagnosed, and if they didn't test in pregnancy, we test in pregnancy now. And so for most women, they will know if they're living with HIV and be given treatment. But that isn't the case for everyone if they don't access care. But then it's that support, supporting someone to just understand their diagnosis, recognize that they are a powerful human being that does not deserve any stigma, shame, or fear, and supporting them to live their best life. I keep saying that, but it's about thriving and enabling someone that they're not defined by their diagnosis. And so there's a lot of work on talking to people. There's one of the most important things we've done in HIV response is encouraging peer support. So other people that are living with HIV to speak to you, to say, I'm living well. I go through dark days, as everyone does, but I also go through good days. And this is how we can support each other. So definitely, there's some great organizations out there.
Okay. How can we reach them? If someone's watching, is there, can you share?
Yes, so
the links with us?
there are. So I would say you go online and you search for HIV support organizations in Ghana, and there are many organizations out there like Garnet and others. So please do, and really, at your clinic, you can go and ask for support. They will offer it, but please seek it as well.
There's help if you're living with HIV. Okay, so tell us about HIV and pregnancy.
So one of the myths is that people say, right, I'm living with HIV, that's it. I can't have a partner, I can't have children, my children will be living with HIV. Absolutely not. So we have treatment now. So first of all, before you get pregnant, you're living with HIV, as I said, the important thing is to be on treatment and to be undetectable. So
okay, pause on that.
There we are.
Joke. Okay, so tell us how. If your woman know you're living with HIV and you want to get pregnant,
yes,
what's the process?
Yeah, so your treatment is your friend, because you want your virus to be undetectable and to go down to 0. So, and for the virus to be controlled. That's one thing. And then it's with your partner as well. So if you know your virus is undetectable and you're speaking to your doctors and you're aware, then you can have sex and unprotected sex and you won't pass it on. But also we have something called PrEP, which is pre-exposure prophylaxis. So this is a tablet that someone can take daily, that if they are a partner of someone living with HIV, or they're having unprotected sex with someone and they don't know their HIV status, they can take it and it will prevent them acquiring HIV.
Okay.
So that is out there. So then you want to get pregnant, you're having sex in the way that you would have, and I think it's important to let your doctors know that you're trying to go on folic acid and boost yourself like you would anyone else. And then go on to be regularly monitored, because that will do your regular viral load testing to make sure that your viral load is still 0. And with that, you can, for some time, to just protect them as well, regardless.
So can two people who are living with HIV have a child who is HIV free?
Exactly.
How herbal treatments and HIV?
So I have so many conversations about this because particularly, you know, I was born and raised in the UK, and we talk about herbal treatments, but not as much as the setting in Ghana.
Yeah.
And I respect the discipline. I respect the opportunity that herbal medication can bring. So I want to say that front and center. But I think that what we know and the studies that we know, that there may be some herbal medications that support your day-to-day life. But in terms of treatment, the treatment out there is the medical treatment of antiretrovirals that control and suppress the virus. And also I would say that someone living with HIV on treatment and they're on herbal medications, please tell your doctor, because there are some herbal medications that affect the efficacy and the strength of some of the antiretrovirals. So be open about it and share, so we can make sure that you're on the right treatment and you're not taking anything that could really affect the strength and effectiveness of your treatment.
Right.
And you know, and it's also, you know, with these conversations, it's about respecting it. We're in a very strongly faith-based society.
Yes,
and so people look at themselves in the context of their spirituality as well. And this is something that they have a condition that, you know, they don't want, and they're thinking that they're not in control of it, or it's been put upon them. So I understand that mindset. But in my work, I don't separate it out. I bring your medical aspects of it, and if your faith is important to you, your faith aspect, and to say that part of our work is supporting you to take treatment and supporting you to live in your faith as best you can.
Right. Are there initiatives that the health sector has put together to sort of help create support?
Definitely.
Are there initiatives? There was something like a 2025 National HIV Response Sustainability Roadmap.
Yes.
What's happening to that?
So in Ghana, and overall with the Ghana Health Service and the National AIDS Control Program, they're really working hard to raise awareness about HIV, to make sure that everyone living with HIV gains access to treatment, because only around, I think the value is around 68% of people living with HIV are on treatment. So there's a gap. So there is a lot of work in raising awareness on media, on doing community outreach for testing, and then supporting people with their pathways to care and to support as well. So there's a lot happening there. For myself personally, you know, I do a lot of work against HIV stigma, because as I said, that HIV stigma is the key thing that really, really limits how far we're moving with HIV. And so it's about education. It's about getting out there in communities. It's about creating a safe space in clinic that you can come, no matter your background, any concerns, and just say, I would like to speak to you more about what's happening in my life. So safe, non-judgmental spaces, being out there in the community, and raising awareness amongst all of the medical profession to encourage people to test.
Okay, so for stigmatization, I do know that in some hospitals, the HIV center is pretty much secluded from the rest of the facility.
Yes.
So stigma is starting right there at the clinic. What's going to be done about it? Are they moving it?
Definitely. So, and you know, this happens everywhere. So in the UK, I talk about this a lot.
So why?
And I think it's from the tradition of where sexual health services and HIV services evolved from. You know, it evolved from a place of stigma. And, you know, it evolved from a place of fear and misunderstanding. But then also it's a specialty. So a lot of services then said, we need our own space to support people to get the care that they need. So I understand a lot of the mindset. But I think the one of the important things is that whether you are in the cardiology clinic, whether you are in the antenatal clinic, whether you are in the diabetes clinic, that the conversations about HIV are there too. Awareness is there too. So it's not separated, because often people will only talk about HIV in the HIV center or the sexual health center.
I think that's where the stigma starts from, because
exactly.
At the Tema General Hospital, it is pretty far off. And so if I had HIV and all these people were walking into the hospital,
yes,
I would feel weird if I'll be the only one branching into the HIV center.
Completely.
So maybe we should stop stigmatization from there, find a way to work around it.
Definitely. I think about expanding access points and being more creative about how we can all work together is really important as well. So yes, definitely.
Okay, so what key elements of the HIV response, for instance, campaigns, which one do you think we should focus more on? Which one do you think from your research would work, so that we just don't waste time on all these things?
So I think, so with the campaign specifically, you know, I love World AIDS Day, 1st of December, you know, our mindset is out there, but I don't think that's enough. It needs to be every day. It needs to be throughout the year that we are out there raising awareness, speaking to people and allowing people to share their fears with you so that you can support that. But on top of that, it's about expanding where testing is. We know that the earlier that you test, the earlier that you're diagnosed, and the earlier you can become undetectable and have less chance of having more complications. Right. So early testing and early diagnosis. So making sure that we're in areas, doing testing and diagnosis in churches. You know, I go to churches, set up a stall, put a place there, let people come and talk to me and test. So
people come. When you go, people come.
You know that things are changing.
That's
and people
nice
and the key thing, people want to know, okay, if you're testing me, what are you going to do afterwards?
Yeah.
So explaining that treatment is accessible, there's support out there where they can go, that changes the conversation completely. So it's making sure that we're out there. And social media, our youth is something that a real area I'm really passionate about, because we're seeing rising levels. So we need to make sure that our youth are aware of HIV and are aware of where to test and know that it's safe to test as well.
Safe to test as well. Okay, and then daily 42 new infections on a day.
Exactly. You know, we are seeing the levels rise. You know, as you said earlier, that we've got over 15,000 people that were diagnosed in 2024.
Numbers are crazy.
Exactly. So we're seeing new infections a day, and we don't need to see that. You know, there's treatment out there, there's prevention out there. So we just need to bring that all together so that we can get to the point that we end new diagnosis of HIV in Ghana.
Right. In wrapping up, Doc, give us one take home about HIV.
Test, and know your status.
That's it. Test, know your status, guys. We'll be having a conversation on HIV, test, treat, and live with Dr. Vanessa Pia. She's